Well, thank you for the introduction and for the really fascinating presentations that we've had so far. And I just wanted to say a really heartfelt well done. I think it's a brilliant collaboration, and managing to do what you've done so quickly and to get such a robust report with some really pragmatic things in it is really most impressive. So we and my teams are looking forward very much to working with you all and others in London to really drive these ideas forward and to make them into realities. I've got previous experience, but when I was reading about the public health for the East Midlands some years ago, I was fortunate enough to spend a brief time in New York and met people from the health department there really focusing on smoking and what they were doing for smoking. And my colleagues and I, from all sorts of organisations in the East Midlands, found it incredibly powerful just to have the alternative complementary view of what can be done and what can't be done and what works and what doesn't, to learn together about the challenges. So that was a really brilliant, positive experience for us. It gave us some real boosts, and I'm hoping that this will do the same. And obviously already is building momentum, as you can see from the people that are here today. I also have a personal reason for wanting America to sort out this child health obesity and help us too, because I've got a family and grandson in America and I'd quite like him to grow up healthy, so you can learn both ways. That's really good. So just reflecting on what we've heard of it, I think we are very fortunate here in the UK in that we do have the context that you've heard about of the Healthy Weight, Healthy Lives, the sort of national obesity strategy. So there is an enthusiasm and a national context within which we can set the more local work that we need to do. The initiative with the national policy has got three themes, one of which is about helping people to make healthier choices, another is creating the environment in which they can make those choices. And the final one is then making sure that there are effective services available for them to help them in whatever way they need to improve their weight and to stay healthy. Those three things are being taken forward in various ways, whether it's through the Healthy Schools campaign or the Change for Life, or the Healthy Towns. I think that's quite, especially the Healthy Towns, I think that's really quite exciting. And Town Hamlets, I think, is one of those across the country. And they are having some £30 million across the country being put into the initiative. Great idea. Let's see what we can do at a local level to make a difference. But the risk with all of that, I think, as it is with the national strategy, and as it is potentially even with the regional one, with the regional health inequalities, with the GLA's health inequality strategy that we're coming on to talk about in a moment, the risk with all of these is that they stay very theoretical. People talk a lot, have lots of community meetings, get very inspired by each other on a good day, depressed on another day because it's all so hard. But very little happens on the ground, and then where it does happen on the ground, it remains in a series of projects and local initiatives, inspired perhaps by local enthusiasts, or perhaps by people who trying to encourage local activity. But however it happens, loads and loads and loads. There are thousands and thousands already of local projects in London, absolutely fantastic when we possibly go. But most of them struggling on a day-to-day basis to wonder where their next few pounds are going to come from to keep the momentum going, and where the next people are going to come. You can only be successful in the world, you can only keep going for so long. You do get tired, you do get worn out. Other enthusiasms come along, or other pressures come along. So sustainability and building in real sustainability in all the resources that we need to keep them, whether it's the human or the financial resources to keep them going. I think that's a huge challenge for us, all of us. And that's one area where I'd really like to see us looking and sharing with each other ways of genuinely making that happen. I'd love to see us making sustained improvements in the health of our children together, and I'd like to see, I really do want to see the health inequality strategy as an overall, the overarching strategy which will give inspiration to that. It's got to be rooted in local and engagement, and say in the sustainability obesity. So that's my real concern at the moment, and I hope we sort of keep that very much in mind as we move forward. There isn't time to talk through each of the recommendations. A few more just comments really on some of the things that we've heard. The schools and the free school meals, particularly for primary school pupils, again, I think this is a brave initiative.